Thanks, Stacy. Well, maybe some of those vehicles are heading to the dentist, although with dental offices closed except for emergencies, taking care of our teeth during the pandemic can be a struggle. Joining us this morning with some tips on how to keep our teeth and mouth healthy, Dr. Elena Kucey and Dr. Brian Kucey. Good morning to you both. Thanks for coming on today.
Good morning. Good morning.
So we might as well get right to it, Elena. How has COVID-19 affected dental care?
Well, first of all, we are in a situation right now where we are asked to see mainly emergency patients that can't be managed with phone calls or perhaps some prescription help. So as times have changed, we are not seeing our number of patients that we were usually seeing in our offices, but we are still available to help people to at least find out what their main concerns are and help them get through by some time, I guess. Yes.
So Brian, can patients still see their dentist for routine care, or is that something they're going to have to wait for?
No, Mike, we're still dependent on the provincial bodies and the college, and only emergency services that cannot be managed by over-the-counter medications are permitted. And most of our work's being done on the phone right now with our patients.
Elena, I came across a term, Tella Dentistry. What exactly is that? You're getting advice over the phone? Is that what that is?
The phone, fax, we're Skyping people, we're Zooming people, we're using all kinds of technologies to help our patients. And of course, we have to make sure that every time we speak with them, there's a secure way to get the information, to hear their problem, to access their personal information, to assess what we can do to help them, because not all of the patients that we're speaking with are necessarily people we've met yet. So we are still needing to make sure that we understand their health needs before we can provide advice.
And let's face it, Elena, it's really important to maintain that oral health, even though you're working at home.
Absolutely. This is the best time to remember all of the tips that we have been sharing with our patients over the years. The hygienist telling you to floss and brush regularly, brush for 2 minutes, twice a day at least, watching your diet, being very, very careful with the types of foods that you eat so that you're hopefully preventing problems from becoming worse. This is a great time for families to make a routine and stick to it so that everybody is on board, so the kids are watching if parents are being actually true to their advice. So mom and dad, you need to do this too. And for our senior patients as well, I mean, a lot of them are in a situation where they're not able to see their families, they're perhaps lonely, and we don't want them to forget to take care of the most important thing, which is the mouth, where it's the beginning of our entire body and the connection to our entire systemic health. So we want to make sure that it stays healthy with all of the good things we can do.
So Brian, we talked about teledentistry earlier in the interview. What about digital dentistry? How does that work?
Well, digital dentistry, Mike's been a term been around for about 10 to 12 years, but these days prosthodontists are leading the way in the use of this digital dentistry in diagnosis, in consultation, in treatment planning, and even making restorations and following their patients up long term. So the teledentistry, which is currently being forced upon us really with COVID-19, is something that's springing ahead now that we have this in place.
Doctors, thank you so much for joining us today, and good luck. Stay healthy.
Stay healthy, everyone.
You too.
Thank you. For more information, you can visit them online. There's the website. It's kuceydental.ca, and they've also got southedmontonpros.com.